I am very pleased to introduce you to our first speaker, Karen Hirsch-Ernst. She heads a specialist group here at BFR that deals with nutritional risks, allergies, and novel food. And she will now give you an overview over risk assessment approaches and methodologies. I'm very glad she's here, and a very warm welcome, Karen Hirsch-Ernst.
So good morning, everyone. Thank you for the kind introduction. Today's session is about safety assessment and risk assessment of superfoods. And this first presentation will provide some thoughts and information on risk assessment methodology and general risk assessment approaches. Okay. And setting the scene or the scope for this presentation, it's important for me to emphasize that this is about safety aspects for human health of superfoods. So it's not about medicinal use of superfoods. It's not about health claims, and it's also not about purported beneficial health effects. Also, I would like to concentrate this talk on substances that are currently not considered to be novel foods. The reason being that I would like to concentrate on substances that presently are being marketed but have not undergone a pre-marketing authorization. And among these substances, or these superfoods that are being marketed but have not undergone an authorization priorly, I would like to exemplify the special case of other substances than vitamins and minerals that are being added to food supplements and fortified foods. Particularly, I would like to focus on the issue of botanicals and botanical extracts. And using these examples, I would like to show you which challenges we might face in trying to assess such substances. And finally, to illustrate these challenges in risk assessment, there will be two examples to be presented on substances that have recently been subject to risk assessment by the BFR. On the one hand, piperine, which has been gaining increased popularity in use as food supplements as a so-called bioenhancer, and on the other hand, hydroxycitric acid, or extracts of the plant Garcinia cambogia, which have been used in supplements as so-called fat burners. So I'm very, very grateful and thankful to the speakers who presented yesterday, because they have wonderfully set the scene for information on EU legislation, on the legislative background regarding foods, and have also detailed on some legislative instruments that currently already are in place and which in part might be used for potential regulation also of superfoods. So as we all know, according to general food law regulation, Article 14, all foods must be safe for consumers. They may not be placed on the market if they are unsafe. However, we know that numerous foods are being marketed without having undergone an authorization procedure. And the question is, how do we know that these foods do not pose a risk to consumers? Well, in this case, authorities would have to perform a scientific risk assessment. And scientific risk assessments are generally or automatically performed in the context of certain food authorization procedures. For example, in the case of authorization of novel foods, of which, of course, we are all aware. So just as a reminder, you know that the conditions for authorization of novel foods are that they may not pose a safety risk to human health. That is according to the different procedures. Article 10 procedure, for example, the assessors, in this case it would be EFSA, would have to conclude that a safe use is possible of the novel food under the proposed conditions of use. Under the so-called Article 14 procedure, for which not only EFSA but also member states are involved, it would be important to conclude that a history of safe consumption has been established. Now, of course, the basis for performing risk assessment are good data. And EFSA has provided guidance already some years ago on data requirements that would be required to conduct risk assessments of novel foods. And in this table, you see data requirements for applications for authorization of novel foods according to the Article 10 procedure. And on the other hand, requirements for notification of traditional foods from third countries. And I would like to focus on the requirements of Article 10 procedure, so on this side. And as you can see, there are many, many aspects that need to be covered in these applications, ranging from information on the identity of the novel food production process, specifications, compositional data, history of use, data on kinetics of substances in the novel food, how they are absorbed, distributed, metabolized, or excreted by the human body, nutritional information, toxicological information, and information as to whether there may be an allergenic potential. And it's important also to keep in mind that if EFSA, in this case, realizes that the provided data are not sufficient to conclude on the safety of the novel food application, EFSA may ask for clarification by the applicant and also may ask for additional data. So in the assessment of novel foods, actually the assessors are in quite a comfortable situation. On the one hand, we can assume that the applications will cover many, many aspects of risk assessment. In particular, we can expect to receive information on toxicological studies, for example, at least in the minimum information on whether in vitro genotoxicity might be a problem. And also, we would hope to receive repeated dose animal studies, such as a 90-day study. And of course, if human data were available, we would expect human data to be submitted in this case. And on the other hand, EFSA has the possibility to ask for further information. And this is a very good thing, which is important for clarification. But on the other hand, we know that many substances that are being marketed as superfoods have not undergone an authorization procedure. Many of these substances have not been classified as novel foods to date. Still, they are on the market. And in many cases, this concerns the BFR, and it will concern other risk assessors at EFSA or other authorities in Europe, in that risk assessors may be asked by risk managers to provide scientific advice on safety-related aspects of such foods that are already on the market and have not undergone prior authorization. And we still might be asked to perform a risk assessment, provide advice in order for risk managers to conclude and perhaps initiate managerial procedures. And this might be in view, for example, of general food law, in that the general question might be asked whether the foods might pose a risk for consumers according to Article 14. But it's also possible that risk assessors might be asked about the safety of other substances in view of preparation of an initiative to activate Regulation 1925/2006, laying down provisions regarding the addition of vitamin minerals and other substances to foods, meaning that in the case where a member states perhaps plans to suggest that a certain substance or a certain food might be placed in Annex 3 of the regulation, meaning that it might be prohibited, restricted, or put under community scrutiny. One of the prerequisites is that risk managers are informed on possible health risks, and this is where the risk assessors come into play. So in such cases, risk assessments are required even without authorization procedures. Now, the problem being that in these cases, we have no specific general data requirements for such superfoods or other substances, for example, being added to food supplements. So we have to make use of the data, the available data that are out there in the literature, meaning that we are also if we can't find other information, we are also taking into consideration gray literature, perhaps abstracts of certain conferences. And I know from a qualitative aspect, this is not the optimal basis for a scientific risk assessment. But we try to do what we can, and we try to make the best of the information that is out there. And depending on the comprehensiveness of this information, we try to conduct a scientific risk assessment based on the general principles of scientific risk assessment for foods. And this scientific risk assessment, of which you are, I assume, aware of, comprises different aspects: the aspect of hazard identification, meaning that it is important to identify potential adverse effects of a certain substance in animal studies or in human studies. Then there's the aspect of hazard characterization, where the hazard is looked at in detail and is characterized in a quantitative and qualitative manner. For example, the severity of effects, the quality of effects are investigated, and one tries to establish a dose-response relationship. And the dose-response relationship, if it can be established, is important also to identify so-called points of departure or reference points, such as no observed adverse effect levels or lowest observed adverse effect levels, since they can be used for perhaps deriving health-based guidance values, or they can be used for so-called margin of safety approach. And then, of course, a risk is not defined purely by the hazard, but a risk becomes a risk under certain conditions of exposure. So we have to consider exposure assessment, if this is possible, if we have sufficient data. And in the final step, and this is actually the crucial step to be able to conclude whether there is an appreciable risk or not, this is the risk characterization. And in this final step, all the information considered in the previous steps on hazard identification, characterization, and exposure assessment are integrated, and hazard and exposure are related to one another in order to conclude whether adverse effects might or might not occur in the population. So this would be the procedure under optimal conditions. In reality, in many cases, when we are assessing other substances, we have very limited information. We might be able to gain some information on potential adverse effects. Nevertheless, it's often not possible to establish a robust dose-response relationship, and regarding exposure assessment in the human population, this is also often quite difficult. So when we are going about a risk assessment, here are some details on the information that we would like to have. So we would be considering data from animal studies, we would be considering data from human studies. If we have well-performed information from human studies, these would have we would prefer them as compared to the animal studies. But often the quality of the studies is not very good. For example, also for the animal studies, rarely do we have animal studies or study reports that are based on OECD guidelines. We would like to have data on mechanisms of action to be able to assess whether certain effects might be plausible from a mechanistic point of view. We would like to have data on ADME and absorption, distribution, metabolism, and excretion in order, for example, to conclude whether a substance might accumulate in the body, just as an example. We would have to take into consideration the duration of exposure, because we need to differentiate between acute exposure to certain substances, meaning just exposure for one day or one time, and on the other hand, chronic intake or an intake over a longer period of time. And there might be effects that we, of course, would not observe and would not be relevant after short-term exposure, but might occur in the course of months or even years. And this might be certain effects of organ toxicity or in some cases even carcinogenicity. So usually we don't have much information on long-term exposure. And we always try to take into account vulnerable, sensitive parts of the population. We specifically try to consider pregnant women, breastfeeding women, children, the elderly, and perhaps persons on medication, on other medication. And in the course of the assessment, we try to identify uncertainties, data gaps, in order to be able to define appropriate uncertainty factors. Because if we do find a reference point, if we can identify a reference point and no observed adverse effect level, for example, we need to extrapolate this information to the general population. So we have to take into account that people in the population differ in their sensitivity, in their metabolism, and also in their dynamic sensitivity. And if the NOAEL is based on animal studies, we also need to extrapolate from the animal situation to the human situation. So there's a lot to be done, and we learn a lot in the course of these assessments. Especially since these are often substances that have not been assessed by risk assessment authorities before. Now, in the next slides, I would like to focus on other substances in the sense of botanicals, because they pose a very particular challenge in risk assessment of foods in Europe. As you know, claims on botanicals are currently on hold. They are not being further assessed. But here we will be talking about risks and safety aspects. And we still need to decide on the safety of botanical preparations. And I just wanted to inform you that EFSA has been also dealing with this question on how to assess botanicals and botanical preparations, for example, in food supplements, and has also discussed whether under certain conditions, perhaps in a data-poor situation, it might be possible to preliminarily conclude on a presumed safety. For example, if it is known that a certain botanical is already being consumed in Europe or has been consumed in the general population already for many, many years, and no adverse effects are known or have been reporting that might be associated with this traditional consumption, then one might assume that if this botanical is added to a food supplement, and the dose of the botanical would be in the range of the daily background intake of the population, that this probably would not pose a risk. But as I said, this would be just a preliminary, presumptive assessment, and yeah, it's a mechanism to be able to provide advice without having, in this case, to wait for months and years for additional data, but it's still a preliminary assessment. So, and here are some concrete examples. Oh, I'm sorry, the picture is quite dark, but as you can see, it's about the substance piperine in food supplements. And piperine is a secondary plant ingredient, naturally occurring as an alkaloid in black pepper and in other pepper species. So what you see up there is supposed to be, these are supposed to be black peppercorns. And well, piperine has become quite popular in the last 10 years, I think, in the supplemental industry, because it is known that it may impact the bioavailability of other foreign substances or xenobiotics. And so it might, on the one hand, it might enhance the bioavailability of other substances in the food supplement. So it might be used as a partner, for example, of curcumin in food supplements to enhance bioavailability and to lead to higher curcumin levels in the bodies. So this is one of the reasons why it's being marketed. But it is also being marketed in its own right as an active substance in food supplements and associated with health claims such as anti-inflammatory effects or anti-carcinogenic effects and so on. So, but I'm not going to detail on these health claims because we have not looked into them, whether they are substantiated or not. But a crucial aspect for the piperine is that it may interact with other foreign compounds, not only with other substances and supplements, but on the other hand, also with a wide array of drugs used in patients. And so this is very important to keep in mind when people who are on or using other medicine or drugs want to take supplements with piperine. Now, piperine has, in this case, formally been assessed on the EU level, but in a different context. It has been assessed as a flavoring agent in the European Union. And it was considered to be safe, and the safety assessment was based on opinions of EFSA of 2008 and 2011, and it was based on the body of evidence, the evidence of toxicological studies taken into consideration, particularly studies conducted with rats. And it was also based on the consideration that the intake as a flavoring agent was assumed to be very low in the European population. As you can see here, this is the, oops. this is the result of a former estimate. Okay, but this was a context of piperine as a flavoring agent. So this would actually involve intake of low doses of piperine and also piperine in combination with other food within a food matrix. And what we have looked at recently is piperine isolated, concentrated piperine, as we might encounter in certain food supplements. And this isolated piperine, when ingested, would be ingested as a bolus, so all at once, a high dose all at once. And the question was whether there was information how this might affect toxicity or any adverse effects. So what we could confirm was that piperine as a bolus in animal studies and in human studies interacts with numerous drugs. And these are just some examples that have been investigated. For example, interactions with beta blockers, with anti-asthmatic agents such as theophylline, anti-epileptic drugs, non-steroidal and anti-inflammatory agents, and so on. Such interactions have been observed in human studies. And they have been observed at 20 milligrams of piperine per day. And as low as 15 milligrams of piperine per day, also there are indications from human studies from interactions with midazolam, which is a benzodiazepine, in that this benzodiazepine in combination with piperine leads to a longer sedation in an increased number of patients taking both of these substances. So in conclusion, we can confirm that based on the literature, based on animal studies and human data, in many cases, piperine may interact with other substances and increase the bioavailability of these substances. So especially in the context of medication, use of other drugs, one has to be very, very careful that perhaps drug levels are not reached that might lead to overdose. Now, in animal studies, we have toxicological information from animal studies, and this does raise concern, because what we have observed is incidence of disturbance of spermatogenesis. We have observed significant effects at a dose of 10 milligram per kilogram body weight per day, and we have also observed indications of some effects, not of them all significant, already at 5 milligrams per kilogram per day body dose. So we have considered 10 milligrams piperine per kilogram body weight per day from the animal studies as being a low observed adverse effect level, with based on effects on spermatogenesis. Also, from animal studies, there are indications of maternal reproductive toxicity and embryotoxic effects, as illustrated here, at doses as low as 10 milligrams per kilogram body weight. Now, the problem is we have no information regarding these effects on spermatogenesis or reprotoxicity from human studies. This information is lacking. So this has led to recommendations of the BFR to be very careful and not to exceed an intake of 2 milligram of isolated piperine per day as bolus via food supplements. Also, we deem it advisable that pregnant women should abstain from the use of supplements containing isolated piperine. And we also think it is important that patients taking other medications should consult their physicians before using supplements with piperine. Another example of a botanical that has been assessed by the BFR, this is hydroxycitric acid from Garcinia cambogia extracts. And the hydroxycitric acid is marketed in different preparations, and often we do not have information as to how these preparations differ from one another. We know that hydroxycitric acid usually is present as a salt, but there are various salts that are being used on the market. And this hydroxycitric acid or Garcinia cambogia extracts are of interest because they have been purported to suppress appetite, and they have been marketed as so-called fat burners at doses up to 3,000 milligrams of HCA per day, which are very high doses. Now, looking at the toxicology, we have some information from animal studies, although this information is rudimentary. We have no information from human studies. And on the one hand, we have one animal study, a 90-day study, shows clear effects on reproduction, testicular atrophy, germ cell generation, impaired spermatogenesis, while studies with other preparations have not reported adverse effects, although it needs to be kept in mind that at least this study, the last study, did not test very high doses of the substance. So animal studies indicate that there might be a potential to cause testicular toxicity, impaired spermatogenesis. However, we have no information from human studies. And many other open questions remain. It's unclear whether these reproductive toxicological effects are due to the different preparations, whether there might be some impurities in the preparations affecting the outcome of the studies. And so there are numerous uncertainties regarding the health assessment of HCA preparations. Also, we have no information on prolonged exposure, no information from human studies. So to sum it up, I have tried to describe or tried to illustrate that many foods or substances claimed to be superfoods are currently not in the novel food catalog or on the EU Union list, and thus they have not been subjected to or are not currently foreseen for an authorization procedure for novel foods. Yet, in many cases, they need to be assessed. We need to know, or we need to have an indication of whether they are safe or not. And some of the examples presented here, for example, piperine or HCA, show that the use of certain foods marketed as superfoods might be associated with human health risks. However, the scientific risk assessment of other substances used in food supplements, for example, botanicals, often face considerable challenges in that we have only incomplete information on the substances in question. We have limited data from animal studies or human studies. If studies are available, they often are of low quality. And in general, such assessments are impeded by considerable knowledge gaps and uncertainties. So, saying this, I would like to thank you very much for your attention, and also like to thank Claudia Luckert, Nadia Bakia, Anke Reisenborn, and Matthias Peiser for contributing to this presentation. Thank you very much.
Thank you very much, Karen Hirsch-Ernst.